Good morning to you. If you've just joined us, this is the South African Morning. Let's bring you this at this point. Healthcare workers who received their J&J jabs in the first half of the year are now eligible for booster jabs. And this is all part of the Sisonke clinical trial to test the efficacy of the J&J vaccine. However, some healthcare workers have been quoted by the media saying they are being used as guinea pigs. For more reaction on this, we're now joined by Deputy Health Minister Dr. Sibongiseni Dhlomo. DM, thank you for your time and good morning to you. That is the concern from some healthcare workers, making it public and known that they feel that they are being made guinea pigs. What's your view on this?
Yeah, thank you very much, and thanks for this time. Even before we gave the first J&J to our healthcare workers, we actually indicated that this is a program that is done worldwide to support the most high-risk team of South Africans who are healthcare workers. Now, firstly, they did take J&J, and now we still have some people who are in hospitals infected with COVID-19. The people who are more exposed to helping those are our healthcare workers. Look, we will always agree that people will not always have the same view, but as we start today, ma'am, we will look into the people who are actually coming forward, and we hope and we know they will come in, because we are saying the scientists are not able to come and define clearly how long is the immunity against COVID-19 after vaccination. And therefore, if there's any group of South Africans who deserve to be supported much earlier are our healthcare workers who were given the vaccine before. There was no noise. Of course, there was that issue even when we gave the J&J. Here again, we are boosting them with the J&J starting the rest of today.
Right. I had a conversation earlier on with the president of the Young Nurses Indaba Trade Union, Ms. Lerato Mthunzi, and she was of the view that there hasn't been enough information communicated to healthcare workers regarding this J&J booster jab. She also reiterated that some feel like, at some point they feel they are forced to take it because they want to protect their jobs. What is your response to this concern about lack of information, adequate information regarding this booster shot, as well as the efficacy, as you mentioned, whether they'll have to take it, after every 6 months or 8 months, because they thought the vaccines or the jabs they took before would be sufficient?
That is her view. I don't know which part of the country she's at. And also, I like you know, ma'am, every issue we come up on the media, we are advised by experts. She does not know, I don't know. The experts are saying to us, it's unlikely that this COVID-19 jab is going to give us a lifelong immunity. That's the story. And they are not able to define. It's a new phenomenon in the world. Nobody had any information on COVID-19 prior to 2019 July. Therefore, we learn as we go, guided by the scientists. Scientists are saying, let's be on the side of safety and protect the most high-risk South Africans who are our healthcare workers. And that information has been dispersed to even before we start. In fact, we were supposed to start yesterday. So I don't know how the communication goes to the unions or to individual members, but we have not had that issue coming in. Yes, of course, we do not expect all individuals to actually support and buy into what we are saying. But we are saying it's not so much about it's about the safety of our healthcare workers who are on a daily basis, even today, are still nursing and looking after people who are COVID infected in hospitals.
Right. Deputy Minister, at this point, we're just talking about the healthcare workers. When it comes to the general public, do you know at this point when these booster jabs would be made available to them, and if those would include the Pfizer booster jab as well?
For now, we are just indicating that the population that is at high risk for this and the need the booster are our healthcare workers. For me and you, we still have to complete the vaccination. To date, we are standing at over 23 million vaccines that have been taken by 16 million South Africans who are at least have had one dose, which means just another 4 million will be at a 50 mark. Of a 20 million, that there will be a 20 million of the 40 million that we want to inject. and we have given about 13 million South Africans who have been fully vaccinated, either one J&J and or a second Pfizer. Now, we still want to push those numbers. Before me and you can be considered for a booster, why don't we get the whole population to get a buy-in to at least get one vaccination or complete the vaccination first? So it's still a long way to go. We would push now because the demand is really, can we have more people coming forward? There's a Vuma weekend again this weekend, yeah.
So you're prioritizing healthcare workers because they are obviously frontline healthcare workers, that imminent or expected fourth wave looming, having to ensure that they are safe first. Understood. With that being said then, I want you to please respond to this. I mean, the SA Medical Association's chairperson, Dr. Angelique Kutsia, saying it would have been very much ideal if healthcare workers could choose their preferred, booster shot here, because some might have had severe, side effects with a J&J vaccine, maybe preferring to have a Pfizer booster jab. Are you at liberty right now to advise healthcare workers to mix vaccines and mix jabs, especially if they obviously took J&J's first and now they may say, we're raising our hand, we prefer the Pfizer booster jab? What's your view?
Yeah, I was speaking to Kutse yesterday and we were talking about that. I think she's really saying she would have preferred this way. But we are again, ma'am, guided by them, the scientists. You know that me and you who have got, they are actually saying if me and you have got a second dose of Pfizer today, and we are therefore categorized as one, either the elderly or we are in the category of having been immunocompromised. We have had a spleen, we have lost a spleen, or we have cancer. We are actually advocating for a third dose. It can't be another vaccine. It would have to be this Pfizer that we took. We have not been guided that we can mix and change. The only time we can mix and change is when you come from a particular country, you tell us you were given the first dose of Moderna and this and that, or you were Sputnik, then the second dose in the country will actually be Pfizer because we don't have the Sputnik or the Moderna. But for now, here in the country, we haven't had an advice that says the first dose was J&J. If we consider a booster, we must do a different one. We have always been actually guided by the scientists that says, give a booster which is similar to what you took before.
All right, Deputy Minister Sibongiseni Dhlomo from the Health Department, I appreciate your time this morning. Thank you for speaking to us. And there you have it, the DM just reiterating that they rely on expert medical advice when it comes to the booster jab. They cannot advise, healthcare workers to mix at this stage. Unless you come from a different country, you took Moderna, then you'll have to take Pfizer because they don't have Sputnik V or even Moderna at this stage. But also encouraging healthcare workers to please take that J&J booster jab.